Welcome to Hope for Med.
Hi, everybody. Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is Dr. Juan Martin Valdivia. He is a neurological surgeon in Tampa, Florida. He moved here from Ann Arbor, where he was assistant professor at the University of Michigan Department of Neurosurgery. In his free time he has, he is a competitive freediver and is involved in freediving medicine guidance. Welcome to the show.
Thank you. It's a pleasure, Doctor. It's an honor to share some time with you. Appreciate it.
So I am so excited to share with my listener all about you and your story. So let's just start from the beginning. Can you please share with my listener your origin story?
So I was born in Lima, Peru, and was born in Lima and went to high school, went to medical school in Peru. Mm-hmm. And my last year of medical school, actually my last 2 years, I decided to go into neurosurgery. I did visiting medical school rotations at Northwestern, University of Miami, got good letters, good exam scores, and I was able to enter an internship in general surgery at the University of Illinois, Chicago, MGH program. So I finished that, and then I mastered in neurosurgery at the University of Arizona, where I was chief resident and finished graduating residency. And then I moved into Michigan, where I took a fellowship in complex and reconstructive spine surgery. I was faculty at Michigan, an amazing time, amazing journey of academic neurosurgery. I also did a fellowship at Emory in endoscopic skull-based surgery, concentrating on pituitary surgery. And then I was always coming down to Florida, coming down back to Peru to visit my family, my mom. And then one day I took a freediving class in the Bahamas, and I was in the ocean, and I decided that the ocean was my home, and I decided to move to Florida because of that, and I'm here. Yeah, that's the gist of it.
Well, so that's a pretty good summary. All right, we are going to go ahead and go back a couple of steps and explore more of why neurosurgery, why surgery in the first place, right? And then why neurosurgery?
So why I personally chose surgery, it's funny you ask. When I was in medical school, I don't have any direct relatives that are either physicians or surgeons. So for me, and to some that may seem a handicap going into medicine, to not having a role model or having someone to teach you the ropes, if you will. But I think it's an opportunity because I was able to discover medicine and surgery on my own, sort of like reading a new book for the first time. And I had obstacles, obviously. I made a lot of mistakes that as a student that I wouldn't have if I had guidance. Yeah, and as far I can go as far as to say that one of my teachers told me I would never be a surgeon. But then you persevere, you continue. I became a firefighter in Peru while I was doing med school, and I did a lot of rescue from motor vehicle accidents and fires, and I saw trauma for the first time face to face. And I was sort of enamored with saving lives. And then I kind of translated that into surgery. Being a fireman taught me to sleep little, to be ready 100% of my performance at any moment. I think being a fireman is a very noble profession. So I feel that prepared me to a surgery residency where you sleep very little and you're sleep deprived. And this was before the 80-hour-week restriction in residency. So we used to work endlessly. In neurosurgery, why I started seeing a lot of neurotrauma, cranial and spine trauma while I was a fireman, actually, back in Peru. And that sort of sparked the interest in me in treating brain and spine. And somehow I started liking neuroanatomy. One thing led to another. I met a neurosurgeon. I went into a case, and that was it. Believe the first time I went into a cranial case in Peru, just to watch or assist, the neurosurgeon told me, if I was sure if I was going to cross that door, because once you cross that door, there's no way back. And indeed, once I went into that case, I never wanted anything else.
Oh, so when you were in that case, they say when you are studying to go into surgery or whatnot, if you can imagine yourself anywhere outside of the OR, don't go into surgery. So when you were in that case, were you able to imagine yourself any place but there?
Mm, no, no. The only way I would do something different if only if I would be not able to perform surgery. I would still be in medicine because I love being a physician, and I love helping people, and that's the fundamental principle of being a physician, is to try to help others, and take the oath. If I wouldn't be able to operate, yeah, I would be a physician, but not in a surgical capacity. And if I was not going to be a physician, I'll be, I don't know, a free diver or an artist or something like that, or a musician. But I love what I do, and sometimes you win, sometimes you lose. And neurosurgery is something that humbles you to your knees. Um, you have to use a certain amount of ego and self-confidence to be able to perform beyond your baseline capabilities in a very difficult case, while at the same time detaching yourself from a patient's suffering. And sometimes you do great things. You can make someone walk again, see again, feel again. And sometimes you can't, even if you work for hours. So this field really humbles me. Yeah.
So, if we could explore that, the wins and the losses and how you cope with both.
Um, we're getting deep, but nothing better than that. I know neurosurgery is one of those things where you use your hands, your mind, your capabilities, and your self-determination relentlessly to try to do a great feat for others and to preserve function as a human being. Preserve function means being able to, as I said, walk again, go back to send patients back to their families on holidays, to be able to live. And so, and not always we can do that. How do you cope with loss? Differently. Every human being is different. Myself, even if I work on someone for hours that is very sick, comes with a trauma, and the patient ends up dying after surgery, is difficult. I don't think any human being can be okay with that, because deep down you feel a loss. There's something that you lose. And when that happens once and twice, 3 times, 10, 50 times in a neurosurgery career, yeah, that's draining. And it can translate into many things: insomnia, sleep deprivation, mood changes in different people in a different way. The way I cope with it is I try to treat all patients like if they were my family, and trying at the same time to detach myself from feelings. And that's difficult because I wouldn't be able to perform the same surgery on my mother, for example, because I would be so emotionally attached to it that I won't be able to perform, perhaps. So you have to do both. You have to perform well while at the same time not being affected by a loss. Um, I try to work out. I try to be in the water. I free dive. I hold my breath when I dive, and that so takes me out. Takes me out. And sometimes I even can't do that, even if I try to. So I don't have the perfect answer for that, doctor.
Mhm.
Yeah.
Truthfully, I don't think there is a perfect answer.
Yeah. No. 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 Yeah, that really, really hits home when you feel. The one thing that really hits home to me is when kids die. Yeah, I don't know how to handle that very well. And I don't think, if someone comes out and says I have the perfect formula of how to handle that, I don't think that's true. You know, I think that always hits you when you're a surgeon. Yeah. Because you try and you try, especially with trauma, with head trauma. Um, yeah, I've had very good results, and some that no matter what you do, you just can't. There's so much we can do. And uh, yeah, that's all I can say about that.
Truth be told, I'm an emergency room physician, right? And we see
Mm,
all sorts of stuff. And there are difficult cases. And yes, children, um, you know, it's hard. It's hard
mm,
to recover from a pediatric code,
mm, mhm,
right? Um, for me, my struggles are with patients that come in and they're walking and they're talking to me when they show
mm,
up in the emergency department. And then within a mere minutes to hours,
mm.
they've died.
Yeah, yeah. It makes you appreciate life because it's so fragile, you know.
Mhm.
Yeah, I don't know how to explain. I've yeah, yeah, I don't know how to explain how. If obviously you feel a loss, you know, and different human beings perceive loss differently. Sometimes some physicians may feel like they lost a child, you know. Sometimes they lost a parent. Sometimes they just lost a patient.
Mhm.
But trying to explain that is too much. I think it's not a flight from my wings, you know. I feel like you just learn, you keep going, but every loss, though, every patient that's lost because of the disease teaches you to be perhaps more aggressive the next time. And even if you learn that or you do try to be better, still you can lose someone.
Mhm.
That's really hard in neurosurgery. I don't think that's where very, that's discussed a lot.
Mhm.
Yeah.
No, you know, the loss of the patient and the way that it affects healthcare professionals is not something that's discussed that much at all.
Yeah, yeah, it's really hard with kids, but you know, sometimes in neurosurgery we have great outcomes, and it depends on timing, decisiveness, focus, technical abilities, and thought process. Sometimes it can make you diagnose something that is subtle, act the right moment, and
Mhm.
act decisively. One of my biggest you know success stories will be if a patient comes in unable to walk and the patient is able to walk by the time is discharged or right after surgery. It's a huge success. I mean, I feel amazing, you know? But or taking a pituitary apoplexy case to the OR because the patient is going blind, and then the patient is you come in the room the next day and the patient is telling you, oh, I can see you now, I can see your face. I mean, that really that's really cool. That's
Yeah.
the word I can use, you know. It feels really good when patients are able to see again, walk again, or hold a pen again, or see their family members. You know, that's huge, especially for families. So sometimes you win, you know, and sometimes you lose, uh, and you know, you need to sacrifice a lot. You know, sleep. You know, sometimes everything comes seconds. Sometimes my philosophy is that when the patient is on my hands and their life is on my it's under my watch, everything is secondary for that couple hours or 6 hours or whatever hours you're in the operating room, and going to the bathroom is secondary, and hunger is secondary, and sleep is secondary. Now that's not easy for a human being because we're not made for that. You know, we're not made to put that second a lot, and we're not created like that, I think. But sometimes to be successful, what do they say? Sometimes you have to shoot a hostage. You know, you sacrifice,
Mhm.
and you feel reward on becoming second to others. I
Mhm.
think there's something to say about that.
Mhm.
So
I agree that there is something to say about that. And there is a time and a place where that is needed. But what would happen if every single second of every single day, you are second to others.
That's not good. You have to, you need self-care in neurosurgery. You need self-love, self-care. You need to rest. You need proper sleep. And neurosurgery residency there, at least when I was a resident, there used to be little of that. We'll wake up at 5 a.m. We'll be in the hospital by 5:30 or 5:45, start rounds until 6:45, and then proper rounds with the chief resident at 7 a.m. until 7:30. And then 7:30, you got to be in the OR. Sometimes you start rounds at 5. Finish the OR at 6 p.m. And then there's another case that you want to see, and you have to stay over. And sometimes past midnight. And then next day is the same. 7 days a week sometimes. And in your surgery residencies, you really keep your finger on the pulse of patients, so to speak. You have to know exactly what your patient's going through. You have to look at trends. You have to almost predict how the patient's going to do in the next 12 hours. If somebody's going to blow a pupil, if somebody's going to get retention, somebody's going to have paraparesis that is missed overnight, you have to be prepared for that because you have to act. And at the same time, learn, and at the same time, sort of neurosurgery residency breaks you before it makes you, so to speak. It breaks you down, it breaks your old habits, and then it builds on those, builds on that with new habits. Like, I think I heard somewhere that if I had a neurosurgeon take care of me, I want that guy to be very nerdy, serious, lack sense of humor, and be very decisive, and OCD at the same time, but also have compassion. So it's not your typical, lovey-dovey, happy-go-lucky kind of person. You have to know how to be like that to perform, and God help you not to bring that home. Because if you bring that home, then things don't work out. And I definitely don't try to bring any work home. If somebody's sick or at home, it needs to be home, and at work is work. Yeah.
So that's a very interesting point that you bring up. And so how exactly do you separate the two? How do you, and at what point in your career did you actually realize that that was really important to do?
I realized that was important when I was probably in Florida, and also in Michigan as well, because when you finish neurosurgery, I think as a resident, one has so many skills, and I don't want to speak for everyone, but a lot of people feel like if you have a hammer, everything looks like a nail. You want to perform, you want to act, you want to use what you learned for 8 years long or 7 years or whatever. So it's easy to get carried away on trying to work and do very complex surgeries initially, and you end up doing that, and then that wears you down. Answering phone calls in the middle of the night to get cases, etc. But that doesn't take care of you when you're sick, when you're down. The way I separate that myself is I just sort of not think of work when I'm at home. I don't have a meditation regimen or anything like that. I try to be in the water as much as I can. I feel like the water sort of cleanses and heals everything for me personally. And I feel like being in the water, especially in the ocean, it's like the big mirror, being in the ocean to me really separates me from work most of the times. It's like the big mirror, because whatever you bring to the ocean will be reflected. If you bring anger or anxiety, it will be reflected back like tenfold. But if you, and I honestly believe this is not science. You're asking me a question, I'm answering you. So if I bring to the water openness and satisfaction, achievement, peace, presence, mindfulness, I feel like the water, I don't know, just it's like you reflect that back on you. I feel like I honestly feel that. I've been working on this. I have my own thoughts about how to use breath hold diving for mental health. So I sort of teach that to people sometimes, and I use the water for my own detachment from work.
Mm.
Yeah.
Mhm. Well, let's talk about a little bit about mental health and healthcare professionals. Do you
Uh,
think that that is an area of importance that should be highlighted?
it's huge. It's huge. I mean, you are. I would say if I looked in the mirror to myself, I would tell to myself that you are your worst enemy. You know, because I can only speak for neurosurgery. This is all I do, and I feel like it's so exciting and so stimulating to do a neurosurgery case when it's so technical, so refined, and you have to be completely present. Um, I feel like how you can um, how you can cope with loss, how you can cope with stress. It depends on each individual differently. Um, but maybe ask me that question a different way. I want to make sure I can answer you correctly.
So you mentioned mental health and
Right.
how, free diving is good for your mental health. And so I
Mhm.
wanted to know in terms of mental health amongst healthcare professionals in general, is that a topic area that needs to be addressed?
That's a huge topic. It's a huge topic because one big topic on that is burnout. Um, if the general public thought or was aware of how much burnout we have, it will be, yeah, it'll be in the news. Burnout is real. Burnout means that the curve of stress in a human being, you start performing when you find challenge, you start performing above your baseline, above and above and above and above until you hit a plateau, and then you keep performing above your baseline, and then your performance drops. Even when you're trying to do, in many cases, long shifts, sick patients, and then your performance drops because a human being is not made to perform above their baseline all the time, every day, right? Mental health is a huge issue. I feel like burnout has to be looked at in surgery, just as it's looked at on pilots, for example. You're not allowed to fly for so many hours after so many days.
Mhm.
But in surgery, in neurosurgery, I don't think that's that's discussed enough.
Mm.
But we pride ourselves in neurosurgery to be, or at least when I was a resident, the more you worked and the less you slept, the better. The more complex cases you could do without any rest or breaks. It was like a chip on your shoulder, you know. Because how else would you be able to perform in the middle of the night if somebody comes dying? The only way you can perform is to stop being human for those, I don't know, 5 hours, and you take care of someone the right way.
Mm.
You put hunger second. You don't need to go to a restroom. You don't need to sleep. You don't need to feel. You just perform and save a life. I mean, what else? That would be the perfect thing, right? You go, it's like a robot. You act, you attack the
Mhm.
problem, fix. Yeah, but human beings are not made to perform like that 24/7. So yeah, mental health is a huge issue. So burnout is important. In neurosurgery, I am sure, in my opinion, I'm almost certain that the incidence of burnout is high, and in neurosurgery residents as well, residents. So
Have you experienced symptoms of burnout yourself?
many times, from when I was a resident until yeah, every year, every month. I don't know how to. I mean, it's just part of my life, and that's okay. And burnout means, coming home at 2 a.m. and waking up at 5 and then going to round, see patients and be there and be responsive and talk to families and give bad news and give good news and then keep going and then a case. And then you finish at 7 and you eat at 8 and you go and sleep at 11 and you wake up at 5 and then you do it again. Yeah. And then the patient comes into a trauma with a blown pupil. You do a 6-hour surgery, the patient dies still because he was too sick to begin with. That's burnout. And you have to like sort of, you as a good, well, I think a surgeon that really wants to not be affected by that, you have to roll off your knife, so to speak, you know? You have to let that go. You have to let it drop and peel off, and you can keep going. And from time to time, you need to take a break, a mental health break. Whatever activity you want to do, you need to do it to disconnect. And personally, yeah, when I take a week off, 2 weeks off, it's like a rejuvenation, it's like a renaissance, and then you're better.
Mhm.
By neurosurgery stuff, I mean, and there's different types of neurosurgery. I practice hospital neurosurgery where we're a tertiary referral center that attends to cases from over 10 other small facilities, and they all come to my hospital, and it's great because we have great variability in cases, diversity of cases, and it's very stimulating. But yeah, there's gonna be burnout for sure. There's hiding it would be silly, but neurosurgeons are trained to work under burnout conditions. Neurosurgeons are trained to to work under stress,
Mhm.
you know, and still perform.
Mhm. Mhm.
Yeah.
So, when you described all of those things about, going to sleep late, waking up after a couple hours, redoing it again, eating late, sleeping, for a couple hours and going back and, dealing with all these stressful situations, in terms of like the, I guess, symptoms you're experiencing, yes, stress, high stress, right? And then also I just thought like exhaustion, right? You're just exhausted and you still have to perform, right?
Yep.
But right, and so those things, right, uncontrolled stress, leads to, exhaustion. What other symptoms of burnout have you experienced in your career?
Oh, well, sleep deprivation is one of them. Headaches. I mean, that comes and goes. I mean, I have a headache probably once every 3 months. It goes away with coffee, you know. I mean, but
Physical
still,
illness.
I feel like I cannot speak for everyone that has a burnout, but burnout means performing at a high intensity, and when the performance starts dropping, meaning you feel just extra tired one day from operating many times, and there's not feeling the satisfaction you used to feel, even, because that month was tough or something, that's burnout. uh, I personally experienced burnout. Yeah, I would say, yeah, I mean, headaches and sleep deprivation is probably the most important one. But honestly, those little short breaks, free time, it makes a difference. Then when I come back to work, I'm brand new, and it just feels different.
Mhm.
I cannot tell you, I mean, many symptoms that I have burnout other than not being able to sleep well, even if you're not on call. And sometimes that happens. Sometimes if you're not on call and it's been a stressful week or a couple of weeks with patients, and you won't be able to sleep well.
Mhm.
I mean, that's human, Yeah. Yeah, go ahead.
Well, there's a couple of things that you've brought up a couple of times, during this conversation that I do think we should highlight is
Mm.
it's human, right? We're human. And I think that sometimes healthcare professionals are not viewed in that light, unfortunately, right? And, you know, uh, we are asked and tasked to do more and more with less and less.
Mm. Wow, that's a big topic, doctor. You're asking me to cross a fine line, doctor. Healthcare. Oh boy, that's a big topic. We can talk for hours. The future of healthcare. Yeah. Working more with less. Yeah. Well, let's take a look at that. Like what do we do medicine for? What are we going to be a physician? We take an oath to take care of others, right? To do no harm. And that really stuck to us, at least not maybe to most people I know. But healthcare is not just that. Healthcare is work using your resources with prioritizing value and quality to deliver adequate healthcare to the community, right? So it's not just doing the fee-per-service model, our habitual all fee-per-service, like the more consults you see and the more procedures you do, the more you make, but it doesn't take care of the patient as a whole. An example would be if a patient comes with chest pain, for example, to the hospital and gets the $1 million workup, chest CT scan to rule out PE, EKG, troponins, echocardiogram, cardiology gets consulted, and thoracic surgery gets consulted. At the end, the diagnosis was unknown or maybe just anxiety, and the patient goes home. It's still with diabetes, still with hypertension, still with diverticulitis that has to be chronic, and they just say follow up with your primary care. When the bill is huge, the patient has no long-term plan, but still that was healthcare, right? Multiple services and multiple fees for each service, right? But how about the model of fee per value, right? So it's fee per patient. You make that patient better. You prevent hypertension, diabetes, obesity, anxiety, depression. What about that? Wouldn't that be ideal to prevent all those things from happening in our communities, especially communities at risk? Yeah, that'll be like the utopic ideal. I don't know how to make that happen though. But in neurosurgery, prevention is huge. Preventing spine disorders, for example. We see the other end in neurosurgery. We see when things are really bad. How to prevent. What I do is spine, and for example, what I tell my patients, first of all, try to avoid surgery to most of my patients, and if I did a really good job, I will be out of work. But the idea is to avoid surgery unless it's absolutely necessary or the patient really would benefit from it. I tell my patients to control your weight, avoid smoking, and get in the water, take up swimming, or do an inversion table, or stretch every day and do yoga, live a healthy lifestyle. It's difficult to instate on all patients to make all patients follow that. But it will be ideal because if I tell you, if everybody did the same, we'll be seeing less surgeries, and that would be better, I think. Yeah.
When we talk about spine surgeries, one thing that I've been coming across a lot in terms of healthcare professionals, in terms of surgeons, that they do suffer a lot from spinal problems, right? It's one of the causes of early disability in surgeons because of. Have you been seeing that?
Yeah, I've seen it, but I don't have statistics on that. But if you ask me to fire from the hip, I would say that doing spine surgery, unless you're using a fancy exoscope, what we call it, where you just look at a screen and you operate out of a tube, you are using loops and you're having your neck like this on almost all surgeries, where cervical, thoracic, or lumbar. Yeah, that creates degenerative disc disease and possibly kyphosis on cervical spine. Akin to using a cell phone, why do everybody comes to my clinic with neck pain? And I see them texting on the waiting room like this all day. So then the upcoming 2, 3, 4 generations are going to be having neck pain to their clinic because they're all attached to this, right? I'm sure there is. I mean, when in spine surgery, sometimes cases may last an hour, 45 minutes to 4, 5, 6, 7 hours. You're standing. And because in surgery, you are so present in the here and now, you forget about the time. You're standing for hours and hours or hours. And then when you finish, you realize, oh, it's been 4 or 5 hours. And now things are more like, oh, well, my spine now hurts a little bit and I'm sore. But in the moment, you're not concentrated on that. I don't know what's a good fix for that. I feel that's why if I spend, for example, hours on end in the OR, I come home and I just start to stretch and be in the supine position or prone and just try to stretch, to a stretching session for 15 minutes at least. It's just to take care of the engine. Otherwise, you won't be able to perform and operate the same years to come. But that's how surgery is. I feel like that's why we love surgery so much, because we are present in the now. We're not in surgery. This is maybe off topic, but in surgery, at least myself, I believe that certain techniques are important to really deliver your best to that patient. One of them is visualization. If I'm scrubbing my hands, just before the case, I'm visualizing the surgery in my mind. And I feel like when I do that, or I do it the night before, when I come in and put my gloves on and gown, the surgery just flows better, much better when you visualize that many times before the procedure. If it's a right-sided surgery, you visualize the right side. If it's a tumor of a certain shape, then you visualize the structures around that tumor. So when you're in it, it just flows. Visualization is huge. And that's something that is used greatly in freediving as well for performance or sports performance. Also, self-programming. When you're about to do something very difficult, you self-program yourself as a mental trick to be able to perform. For example, you tell yourself, yes, I've done this before. I have done this many times before. Therefore, you have some more confidence to perform. And when you're in surgery, we are not thinking about tomorrow. We're not thinking about what we have for breakfast, or if I said the right thing, or if I upset someone. You are there. It's here and now, and that's all. And there's some beauty to that. That's why surgeons like surgery, because you're immersed. It takes you away from everything else or your worries to a degree. I feel like if you come to the OR and you're worried about something else, and half of your mind is concentrated on that worry versus the patient, that's not good for surgery. It has to be the patient and the case now. That's all. So that's my philosophy.
Well, that kind of goes back to my statement from before in terms of knowing that surgery was right for you, because once you found yourself in the operating room, you really could forget everything else, right? Like if you could really just focus in on being in the operating room and not thinking about, oh, when is this case going to be over? Or, I can't wait till tomorrow, or any other thoughts like that, surgery is not for you, right? Like I think that was a valuable piece of advice when I was doing my surgery rotation. As I was retracting, I was definitely imagining myself all sorts of other places, right? So I was like, surgery is not for me, but I definitely think that that's definitely valid. And then going back to the whole stress, right? Because you have to contort your body in different positions when you're doing surgery, right? To get that right angle and whatnot. And, I don't think that there's an easy answer for it, but I do think going into it, realizing that, this is actually one of the potential, I guess, occupational hazards of this specialty, and maybe, being more intentional in terms of like, engaging in like functional fitness exercise programs, right? That kind of focus on strengthening, different muscles to minimize harm.
Yes, I mean, I don't. One thing I can recommend, if I was advising myself on how to do more self-care, is stretch every day, every morning, even when you get out of bed. I have a physio ball and I stretch my spine, my neck, and I get in the water whenever I can, because it's just good for your mind and your spine and your joints. Mental health, recognizing ego and having emotional intelligence is important, meaning being able to manage your own emotions and understand your own emotions and the emotions of others as well, and their expectations, and manage those expectations and emotions. That's emotional intelligence, and that goes a long way with career stability and just career period. I feel like self-care in surgery is crucial. And recognizing that, ego is a handicap. Ego is rampant in surgeons, I think, and it's useful to a degree when you are in a difficult case. You need to feel that you need to have self-confidence and believe in yourself. But there's a fine line between that and ego, or exaggerating ego. Yes, he helps when you're doing a difficult case and you have 4 or 5 hours to go. Yeah, to tell yourself that you're able to do this. You got this. But using the same at home is not going to work. Ego is a handicap, so be careful with that. If I told that to myself in the mirror, that's what I would say to myself. Yeah.
So we've mentioned self-care and the importance of self-care a couple of times during this conversation. And, I remember you said, I don't do like yoga or whatnot, but free diving, when I encountered it when I was in the Bahamas, I think is where you said you went on vacation, you got introduced to it in the Bahamas. Could we revisit that experience? And, was that the first time you were ever in the ocean?
No, I grew up in Peru and I grew up surfing
What
when I
was
could.
different? What was different about that experience?
It's different in other activities. I feel like they're based on, to a degree, you have to have some sort of adrenaline to enjoy the emotion, and it's very physical, to a degree aerobic, yes, and also to look out. You're looking out to an activity, to either scuba diving, you're looking at fish and you're looking at the waves, etc., whatever. But in free diving, you're looking inside, and it's just you and your thoughts, and that can be a scary place to many. It's just you and yourself alone underwater on breath hold, obviously under safety. That I have to disclose, you shouldn't ever free dive alone. You should never free dive alone. You should always follow a safety protocol. You should always get certified by any instructor that is a certified instructor, to follow the basic safety rules. Otherwise, you could die. If you have a syncope, an assisted syncope in the water, your chances of death are high, extremely high, if not 100. So,
Can we take a step back and just go to the basics? What is freediving?
Freediving is any activity that involves breath hold underwater. And it can be as simple as just going under for 5 seconds in your pool, which you should never do alone. But it can be as intense as hooking yourself with a lanyard to a line and going 4 or 5 atmospheres under, meaning 60 meters under, or 50, 60 meters under. And only you can perform that if you are present here and now. And it's easy for me to say, and I've done it, but it doesn't happen every time. It doesn't happen every time the same way or every week. Depends on what's going on in your life. But it's a beautiful experience because it really tells you what's inside you. And as I said, the water, and at least the ocean or wherever I've been, it's like the big mirror. If you come completely clean your heart and your mind, you'll be a more enjoyable dive experience, because it's just you with your thoughts. And if you're going in anxious, you won't be able to perform that well. It's interesting that you mentioned why freediving. Freediving is such an amazing thing. It's freediving, in short, we're genetically coded with mechanisms to survive underwater to a degree and to a certain amount of time. We have physiological mechanisms such as the blood shift, or what it used to be called mammalian dive reflex, or more commonly called now dive reflex, meaning peripheral vasoconstriction, bradycardia, increasing cardiac output, increasing cerebral blood flow. All that allows a human being to be underwater for a certain amount of time. And you just unlock those mechanisms when you train freediving. And I can tell you the most amazing experiences for me in freediving have been where I have no thought. So it's not freedom. It's not, how do you say? It's not freedom of thought like we call it in the West, like there's the ultimate freedom is freedom of thought. Yes, it is. But there's something beyond that. There's freedom from thought. where you don't think, you just are, you just aware. And for me, it's easy for me to say as well. It's not, I cannot do that all the time, barely, rarely. But when I am, it's just you enter this flow state, what is called in flow psychology, where you are immersed in an activity so much and getting constant feedback that only matters. What only matters is that activity, where you're only present. There's no sense of past, future, worry. You're just now. And if I can expand on that, the ideal would be to separate yourself from thought. Like Eckhart Tolle says, if you separate yourself from thought, you're not your thoughts. You just watch them fly like clouds on a sunny day. You watch them and they just come and go. And when you're in that state, and diving is just, I don't know. I am not a 100-meter diver, but I can get deep to a degree. And if I felt that a couple of times, and not many, I've been very happy. I'm being extremely happy. And when I come up from water, then I feel completely detached from not only thought, but the sense of time. Yeah, if you're able to experience that, if you're able to experience it any time during diving, it's just amazing. It's just self-therapy. And this perhaps may sound a lot esoteric and pretty out there to many, but that's life.
Do you go down with an oxygen tank?
No, it's just breath hold. Yeah, it's just breath hold, and it's obviously done in safety conditions with other safety divers. You hook yourself to a lanyard, and you have fins, and you have. So I feel like it's almost self-therapy, because the more you can control your thoughts, your anxieties, and be mindful and aware of yourself and your body, the better you will perform. So it's a way, it's akin to biofeedback, if you will. In the future, I plan to use this to see if I can affect mental health in some fellow divers, if I could. Yeah. But I find it beautiful. I find it's a beautiful activity. From the outside, it looks risky. You may think I'm crazy, but in safe conditions, it's a very eye-opening, almost how do you call it? Very very emotional to a degree activity that I would say, not every human being, but most of us will find joy in practicing. Yeah.
I could definitely see, in terms of when you mentioned flow state and being in a flow state, you described how when you're in the OR and you're doing the surgery, you're also in a state of flow, right? Everything else falls apart, right? Or falls
Correct.
away.
Mm-hmm.
And you're not thinking about your needs. You're just present. You lose sight of time and space and place, and you're just there doing, acting, right? But now with freediving, you're able to recreate that same experience of that flow state, in a more peaceful environment, right? You don't have somebody else's life in your hands. I mean, but the concerning thing about that is when you lose sight of time, right? When you really get into the flow state and you are deep underwater, like, is there a timer, in terms of like these safety mechanisms? Because you don't know how long you've been under the water now when you really get into that state. So is there somebody that's like, you've been there too long, and then they start pulling you up and kind of getting you out of that state of flow? Is that part of the safety mechanisms?
Yeah. Okay. So now we're going into like the technicalities of freediving. Yes, if I could expand, I'm going to walk you through an ideal performance dive. An ideal performance dive will be in a platform or a boat with an arm and a line, let's say set at 50 meters or 60 or 70, and with a bottom weight and then you have a wetsuit, a monofin or fins or not, and then you have a lanyard either on your waist or your wrist, and you clip that lanyard to the line, so you're not going anywhere away from that line, right? And then you are in the water and you do what we call breathe up, or what we most commonly now call relaxation phase, where you breathe tidal volume so that your CO2 it's in normal range between 35 and 45. And then your oxygen saturation is ideally above 95, 93, 95, 98. And then you do a big inhale. And you can either do what we call packing, or in medicine it's called glossopharyngeal insufflation, where you use your mouth as a pump, and you not only go into total lung capacity, but you go beyond total lung capacity. You can get over a liter in. So you're fully inflated with air on your alveoli, and then you descend. And then you have alarms sometimes on your watch. I put my watch under my hood and my wetsuit, and there's an alarm at a certain amount of time or depth. I have to announce before doing that to my safety, by the way, I'm going to a certain amount of meters. Please meet me at certain depth, and I'm going to take 2 minutes. And from the surface, they're at the surface and they're counting. They're feeling the rope. They can feel when I'm going down because of the friction of the lanyard. When I turn, I do a pull, and they can feel that pull as well. And they count and sort of guesstimate where I'm going to be, and they go and meet me on my ascend, let's say at 20 meters or 10 meters, and they follow me up to the surface, watching me straight on, watching my movements, my flow, my propulsion, my technique. If there's any deviation of technique or propulsion or my eyesight, there might be a sign of hypoxia. So if I'm losing the side of the rope, or I'm pulling and I'm having loss of motor control, which in medical language would be a hypoxic fit or tremor, then they'll get me out right away. So that, plus sometimes use the sonar is at the platform. You see the diver go down, they go up, you see the speed. And sometimes in more fancier like competitions, you use something called they use an underwater camera, so you can see actually what's happening. And if there's hypoxia on ascend, usually, which happens mostly on ascend, you will see changes in form, propulsion, technique. And so it's a very safe sport if it's done right. And obviously, I'll tell you, when I had a blackout, or what we call it a blackout, but it's a freediving related syncope in medical jargon, I would say. I was sleep deprived. I don't know why I was doing the keto diet that week. Probably was a mistake. I announced a conservative depth for me, but still was surprised to go down to 50 meters, turn around, ascend. I ascended great, was about to do the surface protocol, and I lost consciousness for 2 seconds. And then I woke up and I kept doing the surface protocol. So I was unaware of my syncope, unaware. I only was told that I had a syncope. And, but again, I was supported immediately by safety divers, and you feel like the sense of community in freediving is, I haven't practiced many other sports, but the sense of community is very strong, because once you're in the water and you are going to do a session of freediving, you communicate with your safety diver, and you immediately put your life on their hands. When you ask somebody, can you safety me, is code for saying, can you save my life if something happens? So we watch each other's backs, and it's a big family. So so there's many safety mechanisms. I hope that answers your question.
How does that feel, being a part of such a community?
It's amazing. It's amazing. I can tell you better things. The most amazing group of people I've ever met. I feel like they're family, no less. Because I know that if something happens to me, they will rescue me, and vice versa, and I'll be there with no other intent other than loving your community. It's a very strong sense of community, and it's just unique. Yeah. It's almost like sacred to be in the water and be able to like trust someone else in terms with your life. If something happens, they'll rescue you. And you have to trust. When you're diving and you're completely immersed in that with the flow state and all that, you have to trust. You have to be happy. And when they trust you with their safety, then that's an honor too. So it's reciprocated every time.
And it seems like you're in a very vulnerable position and situation, and as a surgeon who's used to being in control of everything, how was that become so vulnerable?
It's difficult. It's totally different. I mean, to a degree, it's different than being in the OR because you're not in control of everything at all. You let go, and letting go is not easy. And I cannot do it every time. It's difficult. If I've had 6 patients that month, it's difficult to dive that month. There's no question. It's not this every time just because I hit certain depth. I can do it every time the same way. In surgery, I mean, you have to stomach those cases, and it won't let you dive the same way. I probably would be performing much better if I didn't have my job, but I like my job too. I mean, I like to treat people, so you have to balance it. But yeah, you're not in control. You have to let go and trust whoever's around you.
So, I think free diving and what you've been talking about is absolutely fascinating. If my listener wanted to find out more about you, how can they do so?
They can. I'm a freediving instructor, although I don't do many courses because I barely have time to train myself. But if they want more information about that, they can reach me on my Gmail, janivaldivia@gmail.com. You have my email, janivaldivia@gmail.com, or my WhatsApp is 520-850-9305. So yeah, if there's any physicians who are interested in learning more about freediving medicine, or just people interested, you don't have to reach out to me. There's many instructors in Florida and everywhere. Make sure you just take classes from somebody knowledgeable. I can't promote any agency specific, but I feel like most agencies will give you the basics to be safe, which is number one priority in freediving, is being safe.
And so with that, and in closing, do you have any pearls of wisdom that you would like to leave with my listener in terms of their wellness?
Wellness. Wow. You're asking perhaps not the best person, because I'm a neurosurgeon that works long hours with few breaks for free time dedicated to holding my breath, going deep. But I can tell you that what I use for wellness is, recognizing your limits, being mindful of your own emotions, being mindful of ego, recognizing that ego is a handicap and is useful sometimes to perform activities, but then it's not useful most of the times. Recognizing signs in your own body, knowing your body, knowing the signs of disease and normal state, and always finding an activity to really detach from stress. That is the best way to do it. I feel like it's to be happy and content with your own self, and that's why I feel freediving gives me that. Because if you cannot be happy with your own self and thoughts and emotion, being in a quiet room alone or underwater with your own self, then that's difficult to do it outside that. Taking enhancements, drugs, or stimulants, or just, it's not what I would recommend for wellness. Alcohol or drugs or tobacco, it's not wellness. Wellness to me means being just present here and now with yourself.
Yeah. Who says a doc can't rap? DOCTORJB. The greatest doctor to ever touch the mic. The greatest podcast ever broadcasted or pre-recorded. Come learn some. Each one teach one. I'm done.